Welcome everybody to our May office hours. We'll give people a couple of minutes to make their way in. Looks like we have a good number of people today, so thank you for coming. I will ask you as you kind of get yourself situated, if you don't mind in the chat of the Zoom meeting, just introducing yourselves so we get a good feel of who's attending today. And if you don't mind just putting your name, perhaps your role, and perhaps the city or organization you're with, that would be really helpful. And just a notification, you all probably can see this on the screen, but we are recording today's session so that those who can't make it can view it, or those who want to kind of look back and review on something that we discussed can look at it on the site as well, or on our YouTube site as well. Thank you everybody for introducing yourselves. Just to introduce myself, my name is Jacqueline Betcher. I'm the Senior Project Coordinator with the City Health Dashboard. And with me today is Anne, if you don't mind introducing yourself as well.
Yeah, thank you, Jacqueline. Like Jacqueline said, my name is Anne Bierce, and I'm a data
Anne, I think
analyst.
You're muted, or I can't hear you.
Oh, you can't hear me?
I can hear Anne.
While Anne's working out her audio, which happens to us all, Anne is a data analyst on, oh, you can hear Anne. Then it's just me. Sorry, Anne, go ahead.
No. Oh no. Well, everyone, yeah, please type in if you actually can't hear me. Although if you can't, then you're not listening right now. But I'm a data analyst at the City Health Dashboard, and we'll be talking a little bit more today later on in the presentation.
And Becky Offren's also here today. If you don't mind introducing yourself as well, Becky.
Sure. Hi, everyone. I'm Becky Offren. I'm the Manager of Engagement and Partnerships for the City Health Dashboard, and I'll just help out in the chat today. Thanks.
Thanks, Becky. Yeah, so we're going to keep the chat function on throughout today's virtual office hours. And as we kind of go through, you all may have questions that are either in the moment or ones that you just want to write down so you don't forget towards the end. So go ahead, feel free at any point while we're presenting and discussing, go ahead and drop any questions or comments you have in the chat. And we can answer those kind of as we go. In addition to, once I'm done presenting and Anna's done presenting, we'll have kind of a Q&A section at the end where we can look through those questions or comments in the chat, and also people can take themselves off mute and we can have kind of a further discussion. For those that are signing on now, if you don't mind introducing yourself in the chat, just with your name, perhaps your role, and perhaps the organization or city you're with, as people have done before. So today we're going to review the dashboard and provide a demonstration for those that are unfamiliar with this site or new with the site, as well as a review for those who are familiar. And then Anne is going to do a deeper dive exploring a couple metrics having to do with income inequality and racial and ethnic diversity and segregation. And then, like I said, at the end, we're going to have our Q&A session. So let me go ahead and share. You all tell me if you can see that. Give me a thumbs up. Thanks, Anne. So just to review, our goal is to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. And we're here really with the ultimate purpose of helping mayors, city leaders, citizens improve the health of their cities, either through legislation, programs, or citizens wanting to learn more about the issues in their city, either to advocate or become more informed. And so the dashboard, just a little bit of history, launched in May 2018, and it was developed by our team at NYU School of Medicine within the Department of Population Health in close collaboration with NYU Wagner School of Public Service, the National Research Network, the National League of Cities, and the International City and County Management Association. And we also work really closely, as some of you may know, with our city partners to create an easy to use one-stop shop to help create healthier and more equitable communities. And so we're continuing to kind of speak to new cities, get feedback, and continue to hopefully improve this resource. And so, as some of you may know, we have multiple data releases a year, either to update our data products on the site, add new metrics as they become available, or we've seen through the feedback that there's interest in those new metrics as well. And so you may already be using the City Health Dashboard to compare health gaps across neighborhoods within your city, comparing your cities to other cities, and I'll show you how to do that as we do the site demonstration later, as well as setting priority or better targeting resources, because a problem may not exist the same way throughout every neighborhood in your city. And so you could just see an example here of one way that you may view life expectancy within your city. And so that is by tract or neighborhood here. And you could see the pretty stark differences that just a couple of blocks or a short geographic area takes place in. And so how do we select our measures or metrics, and how do we put them on the site? So we typically use national data sets, and our data analysts such as Anne really do rigorous and novel approaches when it comes to the analysis and the collection of the data. And we really try to focus on health and the social determinants of health to reflect the public health priorities of cities. Like I said, we update our data regularly, adding new metrics as well to really kind of give everybody the most up-to-date and useful resource that we can. And so here are all of our current measures. We do have plans within this year to add even more. And so they are in kind of 5 different domains. We have the health outcomes, which includes things like breast cancer, deaths, diabetes, high blood pressure in your city, obesity, low birth weight. We have clinical care measures, so preventive services for those over 65, counts of uninsured residents in your city, the physical environment, which includes air pollution, housing with potential lead risks, park access, walkability, health behaviors, physical inactivity, teen births, and social and economic factors having to do with your health. So credit insecurity index, which is a fairly recent addition, income inequality, which Anne will look at later today, 3rd grade reading scores, and other metrics, which we found greatly impact your health. And so most of these metrics will be viewable at the city or neighborhood level, so the census tract level. A few of these, which are in blue, we have data for at the city level. And that's because of data availability from our national data sets. And so let's go ahead and walk through kind of a demo of the site so you can possibly see some of the functionality and resources that the site offers. So if you all can see my screen here, this is the landing page, which you may be familiar with, of the City Health Dashboard. And so we have a few things here. We have updates up top, which we recently updated our unemployment, our new monthly unemployment metric. We have events, research and reports, impact stories all here. I encourage you all to sign up for our newsletter. We do not send it out too frequently, send it out about once a month. And it really has everything on it that either we think you may be interested in, or new updates, new blogs, new reports, new partnerships. And so we have the typical frequently asked questions, way to give feedback to us, how to contact us, things like that. On the left-hand side here, which we'll go to later, we have direct ways to get to blog and media, events, impact stories, take action, which we'll be looking at today, as well as more specific information that on the data. So we can walk through one potential resource today. And so let's just look at Dayton, Ohio. So you can put your city in here. We have over 700 cities currently, and by July, we will have over 900 cities. And so every time you go to look at a city, you can look at it as it relates to a specific metric. So today we're going to be looking within the social and economic factors. We're going to be looking at the children in poverty metric. And so it'll open up like this for your city, regardless of the city that you select and the metric that you select. Up top here is our kind of navigation area, which will take us first to the city overview. And so this is not specific to the metric I've selected, but here for Dayton, Ohio, we can see for all the metrics, kind of at a glance, how that city is doing. And it runs through all of the metrics, which may just be of interest to you when looking at something broadly. We also have demographics for the city. And I also encourage you to look at the demographics by census tract for your city as well. And so you may select something like you're interested in looking at the number of residents that are 65 plus in your city by census tract. And so you can kind of scroll over to see. You can also select, and it will come up on the right side. If you want to compare maybe two adjacent neighborhoods, perhaps we'll select tract 807 and tract 18. And so we can kind of see both side by side here. So that is a capability. Now looking within the metric. So like we did before, so we selected children in poverty. And here you can toggle between years if you want to look at some historical children in poverty data. It will automatically default to the most recent year of data that we have, which is 2019. If we want to look at how perhaps things have changed, perhaps we want to look at 2017. And so depending on what you've selected here, both this section as well as the map will change to reflect the year of data that you've selected. So let's go to the default and looking at 2019. If you are looking at children in poverty and decide that you want to look at a different metric, at any point on each of these spaces, you can change the metric just from here. We don't have to go back and to the landing page and kind of redo. So we're looking at children in poverty 2019. If we want to know more about the metric, perhaps you're looking at your city's values, you're looking at your city's maps, and you have further questions about how the data team, the data analyst looked at this metric. And so we can look here to see the source of the data, which was the American Community Survey, the data availability, perhaps some tips and cautions that we felt were important for readers. And we could look at the complete metric information here. And that takes us to something that we call a one-pager. And it really provides all of the frequently asked questions when it comes to a specific metric. So all of them will say, why do we measure this? How do we measure this? Perhaps some strengths and limitations of the metric. How we calculate it seems to be, is a fairly important thing to look at when you're really trying to break down what this means for your city, the data source, and the references. And so this is available for every single metric that we have on the site, and you can access it through the left-hand side here, looking at metrics background. But how we just accessed it right now is looking at the metric detail page, looking at more metric information, and coming to the read complete metric information here. So there are a few ways to get to this, but it's a pretty useful tool. And so now we come to the city value for children in poverty in Dayton, Ohio. And this is our kind of sense-making statement. So 44.5% of Dayton's children were in poverty, compared to an average of 19.3% across dashboard cities. And so this scale bar will show up for every city you select, every metric you select. And so what they have in common is they will always have this marker here, which indicates the average of that value across all of the cities on the dashboard. Then you have this orange bar, which will always be for the specific city you select. And then thirdly, they'll always have a check mark either on this end or the other. And what that check mark indicates is, the preferred value. So for children in poverty, you would want a lower percentage of children in your city in poverty. For something like physical inactivity, you would also want that to be low as well. And so this may switch either end depending on the specific metric you're looking at. And it's just to help you kind of read as you're going. Just to note that the scale bar that we're looking at above, as well as the map that we're going to be looking at below, are also able to be downloaded right here or right here. And so this may help you if you're trying to create a presentation or create a report for yourself. And so if we scroll down below, you'll see a map of Dayton, Ohio, and each of the census tracts or neighborhood indicated here. And so like we did before, you can scroll over and see the children in poverty percentage for each tract or neighborhood. And similarly to as we did before, you may want to select tract 20 and select tract 903. And those will both pop up on the right-hand side here if we want to kind of, whichever way you're viewing this map. And so we can see that Dayton, Ohio, depending on the neighborhood or tract you live in, you may have a different experience. And then we'll go to the demographic detail section. And so for many of our metrics, we are also able to break down that metric with regards to demographic. And so you'll find this bar very similar. Again, it's the one we saw in the metric detail page, but below we can see this broken out into different ethnic categories. And so for Dayton, Ohio's Asian population, 3.1% of children in Dayton, Ohio were in poverty, when compared to 12.8% of the Asian population of all of the dashboard cities. You can see that for Black residents, Hispanic residents, white residents, and those that identify as another ethnicity or race. And again, we can look at this within different years, as many of your cities may be, the demographics may be changing year to year. Then a function that I find particularly interesting, which we noted before, was comparing your city. And so you may be looking for a reference point, or you may be looking at another city's programs, and you want to know how that city compares to your city. And so we can select any number of the cities that are currently on the dashboard here. Let's say Auburn really quickly. And you can look below and see the difference between Dayton, Ohio and Auburn, as well as the demographic differences and breakdown for that specific metric. Or perhaps you're unsure about which city would be a good comparison case. And so you click here to filter to find comparison cities. And so you can select a city that would be a more fair comparison, right? We're not going to compare Dayton, Ohio to San Francisco. We're also not going to compare it to a smaller municipality or one with a very different demographic population. And so perhaps we want to look at a city that has a similar population, perhaps one that is in a similar geographic region. Those that are a similar city type. And I encourage you to look within on the left-hand side here within the reports to look at our city type report. And so we've broken out cities into a number of city types in order to kind of categorize them either by size, location, demographic, economic status. And so you may want to compare cities that are similar in demographic or the federal poverty level as well. And so you can select these, select by these, and we can see that perhaps 11 cities match Dayton, Ohio when it comes to city type and population. And so we can select, Columbia, South Carolina, which may be a more accurate comparison, and we see how the two cities are doing. Similarly, on this compare metric page, we can select a second metric to look at within the context of children in poverty. And so perhaps we want to select housing with potential lead risk. And so we can look for both within the same data year. We can look at both within differing data years, for whatever reason you may want to do that. And similarly, we have a map below that has the values for children in poverty, as well as housing with potential lead risk, overlaid on top of each other within one map. If you want to look at, you think there may be a correlation, or we want to look at the relationship, we also have a scatter plot here below, which will have one metric on the y-axis, the other on the x-axis. And you can click on any point here to see the values for a specific census tract, which may help you if you want to look at outliers or anything like that. And then we have our take action section. And this is specifically for children in poverty. If you feel that that is an issue that you are aiming to tackle in your city, we have policies and programs that we've collected that other cities or other organizations may publish online or have implemented that you may be able to view and may work for your city. You can also find partners, explore strategies, finding funding, and how to measure that impact. And so we can change this metric to housing with potential lead exposure. We can change it to breast cancer deaths. We can change it to any of our metrics, and we can find policies and programs, partner strategies, funding, impact in this take action section, which, after digesting all of the data for your city for a specific metric, it's kind of the, what now? What could we possibly do? What are some examples that people have done? And the last thing I'll direct you to is you're looking at all of this data, perhaps you found something interesting and you want to download it or have access to it. And so you can come here on the left-hand side and you can access dashboard data here. And there are two ways to do that. You can either download them as CSV or TXT files or an API. And so you can do so here, which here are the instructions. We also give you instructions of how to cite, which we appreciate, as well as further information like the code book, geographic identifiers, the technical document, which really goes into detail about how we source, analyze, interpret our metrics, as well as a list of cities. And so you can either download your data as the full dashboard city data, and that's all our metrics, all of our cities, or you could do so just for your city here below, which is obviously a much smaller data file. As well as you can also access our dashboards API. And so our downloadable data and our API will always be the most up to date. We update both of those at the same time. And so any questions or feedback, you can access, send us an email at info@cityhealthdashboard.com. And yeah, we hope to be in touch about any questions or any comments or any feedback that you have. And with that, I will actually turn it over to Anne, and I'll go ahead and share the slides.
Thank you, Jacqueline. That was super informative. I always feel like I learn new stuff about the dashboard every time I visit it. So today for this portion of the presentation, I'm going to be diving into two metrics that can be a bit more challenging to interpret as they are calculated and presented as indices or scores rather than the counts or percentages that we might be used to. And of course, an index is an indicator or a measure of something. And on the City Health Dashboard, we use a combination of established research methods to produce indices for both income inequality and our racial and ethnic diversity and segregation metrics. So we'll start with an overview of income inequality before moving on to the other two metrics. And then I'm going to conclude with an example of how to use these metrics on the dashboard to inform policy decisions and actions within your city. So why do we measure income inequality? As we know, economic inequality has been growing in the United States since the 70s, and we see this trend on a geographic level in the form of economic segregation, which is where people who are economically privileged tend to reside in communities that are almost exclusively wealthy, while those who are deprived tend to reside in communities that are almost exclusively poor. And research suggests that due to many different factors in their social and physical environments, living in the wealthier community benefits the health of the resident, whereas living in a poorer community poses risks to their residents' health. So at the dashboard, we measure income inequality using the index of concentrations at the extremes. So we look at households with income at the extremes of the national distribution, which is the top 20 or the bottom 20%. And for our latest year of data, 2019, this was less than 25,000 per year and greater than 125,000 per year. And each year we reevaluate those brackets to make sure we have the most up-to-date representation. So a city or a tract can have a score between -100 and +100. And where a score falls on the number line tells us how extreme the differences in income are. For example, a score of -85 would tell us that there are many more disadvantaged people living in an area, whereas a score of +85 tells us there are many more privileged people living in an area. And then a score of 0 is a little confusing because it can have two meanings. Either disadvantaged and privileged people are present in equal numbers, or everyone has an income between our two bracket ranges. So these scores can be used to gain an overall picture of income distribution or be used as a comparison tool with other neighborhoods and cities. We can look at the box plot on the right here to kind of see where our dashboard cities lie The brownish -9 in the middle is the mean. So on average, our cities have a slightly larger concentrations of disadvantaged people living in one area. And you can see that our two extremes kind of mirror each other at +56 and -50. So we really don't get up to the very ends of our indice. So let's dive into a couple specific examples. And Jacqueline, we can go to the next slide, where we have 3 of our dashboard cities. And now this map looks familiar from what Jacqueline presented. And I pulled out one of our cities with the lowest income inequality, which is Flint, Michigan at -50. And then one of our cities with the highest level of income inequality, which is Sammamish, Washington. Then of course, in the middle, we have this like perfect 0 of Austin, Texas. So we can kind of get a look at how each of these is represented on the tract level. Note that the darker blue color indicates a more extreme value, so that can be positive or negative. So this is a case where you'd really have to use that tooltip feature to dive into what the colors mean. It is interesting to look at Austin, our perfect 0 city, because we see such a variety of colors. I've pulled out 2 of our more extreme tracks, which are at opposite ends of the index range. You can see the more northern tract in Austin indicates a tract densely populated with more privileged residents, and the score in the more southern tract indicates the opposite. So this is a great example of how we have such a range of different tract indices that kind of average to a city level perfect 0, and really highlights the benefits of digging deeper into that neighborhood tract level data to gain a better picture of the city. Okay, next slide. Now we'll dive in a little more into our racial, ethnic diversity, and segregation measure. This is actually 2 metrics that are not the same, but they are intensely related. For example, we can stay on the other slide. For example, a particular city could be quite diverse and populated by many racial and ethnic groups, but members of these groups could be segregated into different neighborhoods. And alternatively, you could have a city with low diversity, but be without significant residential segregation. So they are 2 metrics that really interact with each other in different ways. Diversity is super important for population health because, as we all kind of see in news stories, health outcomes can differ between people of different racial and ethnic groups. Therefore, understanding the diversity of your city or community can really help to understand the patterns of health and needed interventions. And of course, residential segregation by race and ethnicity is associated with a range of adverse impacts on health as well. A few examples might be cardiovascular risk factors, elevated rates of infectious disease, and premature mortality. So really related to a lot of different health metrics. Starting with our diversity score, this score answers the question, what is the racial ethnic makeup of this city or tract? Is the area dominated by a single group, or are all groups present in equal amounts, or is it somewhere in between? So again, we have our index, and this index is calculated on a scale from 0 to 100, with 0 meaning that all the residents in the area belong to a single race or ethnicity, and 100 signifying that all of the pre-specified racial ethnic groups comprise an equal proportion of the population. And we can see these pre-specified racial ethnic groups used on the dashboard at the bottom of this slide, and these are set partially by the American Communities Survey, where we get our data. And then we can look at the box plot to see the distribution of our diversity indice at our city health dashboard level. The mean of 62 indicates that cities on the dashboard are on average more diverse than not, but you can see that spread as well all the way down to closer to 10. Okay, we can go to the next slide to dig into an example of how this diversity index can change based on city and tract level. This is also featured on our blog, which I encourage you to check out. So the 2 big pie charts on the upper left, these show the population breakdowns and diversity scores for 2 cities, Hialeah, Florida, and New York, New York. And Hialeah on the left has a diversity score of 20.3, whereas New York City, one of our most diverse cities, has a score of 88.9. And we can see Hialeah has the population that is almost entirely Hispanic, where we see the more even distribution of racial ethnic groups in New York City. So this is great visualization for how the diversity is actually reflected within the score. But digging down to the tract level of New York, which is the bottom set of pie charts, that can demonstrate how different tracts in New York City might be vastly different from what we see on the city level. So these are just 5 tracts. New York has more, but we can see that although New York City has an overall diversity score of 88.9, that score varies widely across the city at census tract levels. And we have some which are more white or more Hispanic. And of course, our final tract pie chart is more equally distributed. So just such a wide variety of breakdowns within the city. Okay. So now we'll just dive deeper into segregation, which again is different but related to diversity. Our neighborhood racial ethnic segregation measures the extent to which a city's racial ethnic groups are evenly represented across its census tracts. So like our diversity measure, segregation is also calculated on a scale from 0 to 100, but for this metric, a score of 100 would mean like total segregation. No census tracts have more than one racial ethnic group residing in them, whereas 0 would mean that perfectly equal representation across all tracts. And as expected, when we look at our box plot, we don't really see any scores of 0 or 100 across our cities. Although on average, our cities are less segregated, although we do see those more extreme outliers at the top. It's important to note that the segregation index is an aggregation of tracts, and therefore it is one of those city level only metrics. So just keeping that in mind as we interpret it. We can go to the next slide. And this is another chart from our blog, which I actually really like, and I think you could hang this on your wall. It's so pretty. But this is a visual that is super helpful in understanding our segregation measure. So we can imagine that the different colors of each rectangle represent different racial or ethnic categories. And then the rectangle on the left would represent low segregation. The colors are all mixed up within the larger space. And in the rectangle on the right, the colors are grouped together. So that would, visually represent that high segregation. Yet it's interesting to note that both rectangles contain all 5 colors. They both demonstrate diversity. So putting together the information from a city's diversity and segregation scores can really expand our understanding of our communities and what kind of health metrics we should be looking at. Yeah, you can go to the next one. We have a great kind of like matrix representation of how our scores might interact with each other. I won't read them all. We can spend some time looking at it, but for example, if like the diversity index is the y-axis on the left and it gets higher as it goes up, and the segregation index is on the x-axis and it gets higher as you go further to the right, we might interpret a high diversity score and a low segregation score as suggesting that all 5 racial ethnic groups are more evenly represented in the city's population, and that the people of different racial ethnic identities typically live mixed throughout the city. Whereas catty corner, like complete opposite, a low diversity score and a high segregation score suggests that the city has 1 or 2 dominant racial ethnic groups, and that people with the same racial ethnic identities typically live in the same neighborhoods. So maybe we can just pause and kind of think about this matrix while I grab some water. Yeah, so and of course this is interpreting these levels to all the extreme, but we most frequently see some mixture of these in the middle. Okay, so bringing it all together, just some more things to think about as we look at these 3 metrics together. I've pulled back those first 3 cities we looked at for income inequality, and remembering that Flint had one of the lowest scores with the greater levels of disadvantaged people living together, And then Sammamish had the high positive score, meaning greater levels of advantage people living together. And Austin in the middle at 0, we saw in the map, did not mean that all the tracts had 0, but that the city as a whole contained people of mixed incomes living together. And just thinking about how that relates to our racial ethnic measures, we look across the metrics here, and these are the averages for the cities. And just noting, we don't really see any obvious consistent patterns of more intense income inequality relating to higher or lower levels of racial or ethnic diversity. We really just see 3 different cities across all 3 metrics. So this demonstrates that these indices are helpful to look at in relation with other metrics and other health outcomes that are related, but that we should be careful as using them as predictors. We never want to make those causal statements, and this is an example of that. But how can we then make those actionable movements? And if we can go to the next slide, I have an example here using that compare metrics feature that Jacqueline demonstrated earlier. And we're looking at Flint, Michigan, with that base blue layer being our income inequality level, and then the red dots representing racial and ethnic diversity, noting again that we cannot really use this with segregation since that's only on city level, not tract level. But you can see I've pulled out a few specific tracts, which are interesting because they do show, again, the range. We have the tract to the far right with the income inequality of -10, and then a very high racial ethnic diversity of 58. And then we have the tract to the left, which has an even lower income inequality score of 60, but still a very high racial ethnic diversity score. So just really illustrating the difference, even in different metrics, that we can see in 2 tracts that are so close together. It's clear that community outreach might need to look incredibly different within these tracts, and that looking at these metrics really does provide helpful insight for many other types of public health work, such as income inequality, race, ethnic diversity, segregation, of course, but you can tie that into some more tangible policies such as housing or access to healthy food. And then on the next slide, I've pulled out, that take action step, and we can access this on the link that I've shared, the take action link, and you can filter based on the metric you want to explore, and that'll pull up a couple of very helpful articles to help us link these things together. And you'll see it's a little cut off, but some of these that I've pulled out include, income inequality and race diversity measures, but you'll see they relate to a lot of other metrics that we highlight on the dashboard, such as housing costs, high school completion, premature deaths, just everything tying together, but some pretty help. This is just a small sampling of the articles on our Take Action page. Cool.
Thank you so much, Anne. That was really helpful and great to see those visuals. And that concludes the presentation portion of the virtual office hours. And now I want to invite you all to, if you're comfortable, taking yourself off mute to ask some questions or some feedback or some discussion points. If you're not comfortable doing so, go ahead and put it in the chat, and we're happy to talk it out. And I'll direct you to the chat also because Becky has helpfully offered the link to the blog that Anne referenced and the link directly to our Take Action page. Great, thank you.
Oh yeah, the blog is super helpful, like you mentioned. And I'll also note that all 3 of these metrics are slated for an update thanks to our 2020 census data being released. So look for that in the summer.
Also, a benefit of signing up for the newsletter is when we release a new data, in July, which I believe will be definitely over 15 updated metrics, as well as a lot of updated geographies and new cities. You'll get an email into letting you know that you can go ahead and access it on the website, and when you may be able to download the data and everything. So another benefit there, as well as when we do publish blogs like these, you'll have notifications to read them first. Great question, Gary. I can start it off, and Anne, if you want to provide more details. So a good number of our metrics are from ACS, but we also pull from CDC's NBSS. We also pull from BRFSS, as well as a number of data sources from other organizations. And so that might be CETA for education, data sources. And Anne, if you have any others that are on our list, I think we have a bunch.
Yeah, there is a bunch. I think you covered most of them, but also if you go to that metric background page that Jacqueline brought us to in the walkthrough, everything is cited there. So you can additionally look through that. And ACS is obviously publicly accessible, but some of our metrics have like a couple more intense calculations, such as these indices that I shared, that kind of cater them to our dashboard specifically, and others we access through agreements with the organization.
And I also just provided a link to, oh yeah, Becky provided a link to the one pagers on each metric. And I also provided a link, which I actually need to update, that's the wrong one, to our technical document, which provides a table which can show you kind of a side-by-side of each of our metrics and the data source. And so we have some, from CDC's Places Survey, the American Community Survey, which you noted, NBSS when it comes to a lot of our vital statistics information, some with work with George Mason University, others, like I noted before, our new credit and security index is in collaboration with the New York Fed. And CDOT, as I noted before, is the Stanford Education Data Archive, as well as our violent crime information comes from the FBI. So we have a few different data sources, each hopefully as appropriate for that metric as possible. Thank you for your question. And like Anne noted, we have metrics that come through our analysis of these federal data sources, but we also have metrics such as the indices that are really kind of our own team's novel approach of analyzing and interpreting some of these data sources. So one such metric is the COVID Local Risk Index, which I will actually provide a link to of something our team published recently in evaluating that. And so that's specific to our own site.
I have another question. While looking at your page on the data, there is terms of use for downloading data, but when I clicked on that, it was not accessible. So that might be something to check out. But the question I have is, our organization does well-being analytics, and it consumes huge amounts of local and national data. But we are not a not-for-profit. Do you allow the ability for us to download some of your data to use in community evaluations related to our well-being analytics?
Yeah, so yeah, all of our data is available to whomever may find it useful and helpful. Thank you for letting us know about that terms of use. I'll check on that. But Becky, I don't know if you have any Yes. So Becky says the data just can't be used for commercial purposes, right?
Okay. So just to be specific, so we work with nonprofits and communities, and we provide them with dashboards and in metrics, but we are a for-profit enterprise. So does that mean that we would not be able to use those data in these kinds of projects, which are really designed for communities and nonprofits?
Yeah, that's a great question. That may be something that we can work in partnership on. And I would encourage you, Becky just put her email in the chat. I would
Okay.
encourage you to email her, and then we can kind of work that kind of specific instance out.
All right, thank you.
Yeah, thank you.
By the way, you did it. It's really a marvelous user interface, and
Oh, great.
yeah, it's really been improving over time. Really looks great.
Thank you so much. Yeah, we aim to continue to get feedback, improve, not only when it comes to the metrics and the geographies, but also just the user interface is definitely important.
Yeah.
Yeah. But as far as investigation, the conversation of the house, as long as it all comes back. We'll just have to figure out what feedback. Yes.
Just answering David's question, the PDF was a wrong link. So the following link that has technical documentation at the end of it takes you to that where you can access that file directly, David.
Great question. So when will we update the data to 900 plus cities? So we are planning for a data release on July 12th, in which we will have updates on a number of our metrics, and we will expand our geographies to 900 plus cities, July 12th. That's the date that we'll do so. Yeah, they are. So a number of the cities that we are adding well, there's 3 different categories. So the first is those that from the time that the 2010 census was taken and to the time that the 2020 census was taken, those cities may have grown past our 500,000 population threshold. And so we're adding those kind of new larger cities. But we're also adding a number of cities that, the census doesn't classify as cities, but instead county subunits. And so these are cities that perhaps have their own government, but are smaller or more suburban, fastly growing mid-sized cities. And then we have, I believe, 29 very small new cities, which we launched a put us on the map challenge that we're hoping to do in the future as well. This was the first of its kind. We launched a challenge earlier this spring that small cities could submit an application for. And so just a very brief application of their city, what their capacity is within the city, and how they seek to use data like this if we were to make it available. And so we selected 29 in this kind of first round of the Put Us on the Map challenge. And so these are 29 new, the smallest cities that we put on the map that we're adding to our site July 12th. And we're hoping to again do that in the future, put out a call for applications and cities of any size, particularly the smallest of cities, can apply for and say, you know, this data would be helpful in either accrediting our health department or providing information at the municipal level, which isn't many of these smaller cities only have county level data available, which may not apply to them, and all of these use cases. So we're hoping to, or we are in July going to launch with a number of these really small cities, and from that we will also get a lot of these impact stories that we'll be putting on the site, and so we can see how providing this data to small and mid-sized cities will be helpful. And so again, if you sign up for the newsletter in the future, that's exactly where we'll have that type of information for you to apply. And then we can get those even more small and mid-sized cities on the site. And we're hoping as we kind of continue going on to really continue to add those small and mid-sized cities to fill up our map. Yes, absolutely. You can officially acknowledge us on your paper. And so we have the recommended citation on our data access page, which I can include in the chat as well. Let me go ahead and paste that in. Oh, thank you. Becky already pasted it. So helpful. Yes, a recording of this meeting will be made available. So after today's virtual office hours, we'll close this up. We'll edit it very slightly to remove me just sitting here in the beginning, so y'all don't have to see that. And then we'll be posting it onto our YouTube page, and it will also be available as a link from our site. Thanks, Becky. And if you log off of this meeting today and still have questions that arise that you perhaps forgot to answer or just didn't want to answer in this forum, I'm going to include our general email address at the bottom here, and feel free to email at any time. All right, thank you so much, everybody, for attending. And that concludes our May virtual office hour. Thank you so much, Anne.